My name is Dr. Adan Abdullahi. I am a plastic, reconstructive and aesthetic surgeon. I specialize in all that field. My background initially was general surgery before further specializing in plastic and reconstructive surgery. The role of a plastic surgeon is three main folds. One, he deals with the reconstructive aspect of the human body. Whenever a body is got a pathology, sickness, or whenever one has had a trauma, for example, he will have to reconstruct that part of the body. They have problems of course, a lady who has had 3 children is not happy with her sagging breasts, for example. She's not happy, low self-esteem. Let me put it that way. They've got usually very low self-esteem. They're not happy, they're depressed, and they'll go. Some of it actually affects the matrimonial relationship. And exercise is very important. That's very important. We must not take away the fact that physical exercise is advocated, introducing as much fat as possible. But we've got this difficult, not metabolically active fat, subcutaneous fat, which form beneath the skin. And that becomes very, especially the tummy. And then you've got your muscles of the tummy which give way because of this multiple pregnancy. And you need to reconstruct this and remove the fat as well. So what we call lipoabdominoplasty. And those are the concerns the ladies have, for example. Scars are formed by, first of all, inevitably a scar will form. But it's even worse in the black skin, in the African skin. In the Caucasian, scars are somehow less visible. But in our community, scars become very visible. And if you look at it, it's because of collagen deposition. During the process of inflammation, the skin edges heal together. So the process of inflammation occurs very smoothly and nicely. But because of one way or the other, poor surgical technique in reconstructing, in closing the skin, or not adhering or not respecting the tissues, scars do form, and particularly so in the African skin. To cure 100%, but you can significantly improve it, by using products like bio-oil. A hypertrophic scar will be, for example, if I could give you an easy one, is the scars you get after cesarean section. Although some ladies still get keloids after cesarean section. That kind of scar will be called a hypertrophic scar. It doesn't do a lot of overgrowth. It's visible, you can see it, but it doesn't go beyond just maybe 1 or 2 millimeter above the surface of the incision. So that one can be managed. And a good thing will be is the moment you're out of hospital and you've healed, don't think that you just healed. Sometimes if you're very concerned about scar, then use moisturizers, things like bio-oil, which has got pursulin. If you use it, the site of the scar will appear much better than if you are not using it, for example. For my patients, the moment this incision has healed, I immediately tell them, go and hydrate it. And I even encourage them to use bio-oil. Some of them will tell you, can I use bio-oil? And I tell them, go ahead. The results are good. I mean, for one who has had tendencies to scar, the appearance is much better. When you use a moisturizer or anything which has got pursulin, something that's going to hydrate the skin, particularly the elastin and the collagen tissue, early enough in the pregnancy, because it's very safe in 2nd trimester or 3rd trimester. After you deliver, your chance of having these excessive stretch marks is less. But most of the Kenyan ladies, I've noticed this, after they have delivered is when now their concern is, what do I do about these stretch marks? So it's important, just apply it as your pregnancy progresses in the 3rd trimester, 2nd trimester, 3rd trimester. Keep applying on the skin, and you'll notice later on that your chances of having excessive unsightly stretch marks is less. So I'll recommend that, and it's pretty safe. I mean, it doesn't have a bad chemical, so it won't penetrate through the skin and affect your baby. Yeah, a lot of ladies come to me, young women, middle age, they come to me and say, I was pregnant, but look at these stretch marks. What do I do about these stretch marks? I think I get about 15 to 20 women who ask me these questions every month, if not every week. Even friends or women who will just call me and say, what do I do about this stretch marks? They don't like stretch marks. Women hate stretch marks. And it's understandable why they hate it, because it's not sightly. Sometimes if you're very concerned about scar, then use moisturizers, things like Biol, which has got pusulin. If you use it, the site of the scar will appear much better than if you are not using it, for example.